name's Macy. I'm going to be your health provider today. Is that okay with you?
Yes.
Okay, so we're going to go ahead and get started on an exam. Can you tell me why you came in today?
Just arm pain.
Arm pain? When did it start?
Last week.
Okay, can you point to exactly where it hurts?
Here.
Okay, and what were you doing when it started?
I was just working in the yard.
And does it hurt all the time, sometimes, in and out?
Really just when I pick things up.
When you pick things up? Okay, and then can you characterize the pain? Does it have burning, shooting, stabbing, dull pain?
It's more of a sharp stabbing pain just when I'm lifting.
Okay, and then is it associated with lifting? Is it anything else?
Not unless I'm like really straining it.
Okay, and then does it radiate upwards or downwards?
It's pretty localized.
Okay, and then so would you rate the severity of it from a 0 to a 10?
It's probably
An
an 8.
8
It hurts.
when it hurts. Okay, and that's when you're lifting things. Okay, and have you had any treatment for this? Have you taken any ibuprofen, any Tylenol, anything like that?
Ibuprofen.
Ibuprofen? Okay, and how often are you taking ibuprofen?
Every day.
Every day. Okay, multiple times a day?
Just at night.
Just at night. Okay, and then are you still working out?
No.
No. And have you ever had injury to an elbow before?
No.
Specifically that elbow?
No.
No? Okay. And then have you seen a doctor for this yet?
No.
Okay. And are you allergic to anything?
No.
And do you take any other medications every day?
No.
Besides the Motrin?
No.
Okay. Any medical problems I should know about?
No.
Any family history of anything?
No.
Okay. And have you had any recent illness such as fever, cough, nausea, vomiting, diarrhea?
No.
Any tingling or numbness?
No.
You can feel and have full function of your hand and arm and wrists?
Yes.
Okay. Well, we're going to go ahead and get started on this exam, and then we can see what's going on, okay?
Okay.
So if you don't mind, for the first part of the exam, I'm going to get you to remove your shirt, and then you can put it back on when we're done. Okay, I can take that for you. So what I'm going to do first is just start with an inspection of the front of your body. So I see that your shoulders are symmetric. I see that your elbows are symmetric from the front view and that your wrists and fingers. I'm going to move behind you. Everything looks symmetric over here. I don't see any swelling. I don't see any abnormalities with any musculoskeletal problems or joints. Now I'm going to start with palpation, okay? So I'm going to palpate the clavicle out to the shoulders, and then I'm going to step behind you. I'm going to go up to the scapula. Right. No pain?
No.
I'm going to palpate out to the AC joint and then the coracoid process. Any pain here?
No.
Okay, I'm going to come from the front as well. Any pain here?
No.
Okay, and then I'm going to lift your elbow posteriorly here, both sides, please. And then any pain with palpation to these joints, the epicondyle area?
No.
Okay. Do you mind removing your watch? Thank you. I'm going to put it, okay. And then I'm going to see your wrists here. Any pain there?
No.
Any pain in this little area here?
No.
This is called a snuff box. Any pain here?
No.
Okay. And then we'll hold out your hands. Any pain in between your fingers?
No.
These joints? These joints? And then these are the most distal joints you have. No pain there?
No.
Okay, great. And you can go ahead and put your shirt back on if you'd like. This time we're going to go ahead and do inspection and, actually let's go ahead and stay up top and we're going to go ahead and do some rotation things. So if you just want to mimic me with your shoulders, and you can stand up and face me, and I'll be able to see how you are able to rotate shoulders and upper body, okay? All right, from here, I want you to go to the side, and then up, and then down, and then down. Do the same thing going forwards. Okay? Great. Now we're going to do something called the Apley scratch test, and it's going to be able to test a couple things such as abduction and adduction, and internal and external rotation of your shoulder. Okay?
Okay.
So you're going to rotate and try to touch your fingers like this. Okay, great. Can you do it with the opposite arm? No, not as much. Okay. Any pain when you attempt that move?
No.
Okay, it is normal for your dominant side to have more of a resistance for that, okay? And so now we're going to test for your elbow. So I want you to go 90 degrees, and I want you to come up, and I want you all the way up as far as you can, and then I want you to straighten back out. Great. And then I want you to go outwards like this, and then move your hands. Perfect. And then we're going to check that rotation of the elbow right there. And now with this one that's been hurting you, let's go ahead and take a closer view. Can you do like a curl position for me? Any pain with that?
Slight, not really.
Slight, okay. And so now we're gonna check your wrists. You're gonna go up, and we're gonna go down, and then we're gonna medially rotate towards in, and laterally rotate out. No pain?
No.
Okay, and then now we're gonna check the rotation, range of motion of our fingers.
Okay.
So I want you to make a fist tight. Any pain with your fingers?
No.
Okay, relax. Now extend your fingers out this way, and then come back in. Great. And now I want you to go upwards and downwards with every other one. Any pain?
No.
Okay, great. And then we're gonna check our thumb. I want you to go to the fourth finger across. All right, great. And then I want you to go outwards. And then I want you to push it away from your palm and then back. And I want you to touch your thumb to the tip of every finger. Awesome. Okay, that's good for your upper body. So let's go ahead and get started on your lower body. I'm gonna go ahead and start with exam and then palpation of your hips, your knees, your ankles, and your feet. Okay? So on your hip, is there any pain in this area?
No.
Okay, and then what about here?
No.
And I'm gonna be reaching for your hip bone, okay? Any pain here?
No.
I'm gonna come to the front. There's your hip bones, the greater trochanter area. Any pain?
No.
Okay, and we can't really palpate further than that. You can go ahead and take a seat. Okay, and then I'm gonna go ahead and do your knee, okay? I'm gonna do this one first. I'm gonna kind of go around the femoral tibial area. Okay, and then I'm gonna go down distally, assessing your MCL, ACL. Then I'm going to palpate around your tibia. Any pain?
No.
Okay, same thing on this leg. Just relax. Okay, I'm going to go down. And then up. No pain?
No.
Okay, and then I'm going to go around your patellar. Okay, both at the same time. I'm just going to feel to make sure they're symmetric. Great. I'm going to remove your socks. Okay, and then I'm going to feel your ankles. They feel symmetric. And then with my thumbs, do you feel any pain to your Achilles tendon?
No.
Okay, and I'm going to circulate around your ankle here. Any pain?
No.
Any pain?
No.
Okay. I'm going to go in between these bones on your foot here, and then down to your feet. No pain with the toes?
No.
Okay. So now we're going to check your rotation of your hips, knees, ankles, and feet. So you can go ahead and stand up, and you're going to copy me. One leg at a time, you're going to raise and pull up to your chest. Okay, now do your other one. Great. And then now just pull up your leg one at a time without pulling it so hard. Okay. Now I want you to do is rotate it outwards. Any pain?
No.
Okay, great. And then you're just going to kind of do this. Okay, that's abduction and adduction. That looks good. You can go ahead and actually before you sit down, I'm going to check your knees. So I want you to do a little mild squat for me. Any pain?
No.
Okay, you can go ahead and take a seat. And then I'm just going to check the medial and lateral rotation of your knees. And then I'm going to grab your heel and hold onto your femur here and rotate side to side. Okay, same thing here. Okay, no pain with that?
No.
All right, I'm going to check this with the same thing with your ankles. Up and down, side to side. Okay? Up and down, side to side. Okay, great. And then can you kind of rotate your ankle in a circle for me? Great. Okay, so I'm gonna get you to stand up and face me. I want you to look up, look down, look side, look the other way. Shrug your shoulders, and then lean your ears to each shoulder. I'm gonna check for resistance. So lean this way, okay. Lean the other way, okay. Now with resistance. Shrug your shoulders, okay. Any problems with any of that?
No.
Okay, and then I want you to move your arms at a 90-degree rotation, and then push up. All right, push down. Okay, great. And then fully extend your arms out, and then pull them back in. Great. I want you to put out your hands, and then we're gonna switch it like this, like we did earlier, and then come back in, and then I want you to show me 2 fists. Great. And then I want you to be able to flex your quads. Okay, great. And then I want you to turn around to your back, facing me, please. And then I want you to touch your toes as far as you can. Okay, and then I want you to kind of rise up on your heels. And then rise up on your toes. Perfect. And then I want you to walk away like a duck. Straight leg. And then turn around and come back to me like a duck. Okay, we're gonna test cranial nerve 5 now. I want you to make a puffy face, frown, raise your eyebrows, close your eyebrows, and close your eyes really, really, really tight, and then puff out your lips on your cheeks. Perfect. Okay, next I'm going to do, we're gonna do what we did earlier, but this is more specific. Lean, lean. Okay, stick your tongue out, go one way, and then the other way, and then up, and then down. That's great. And then I want you to squeeze your jaw as tight as you can. And then open and close your mouth. Okay, great. Okay, sit down for me. Now on your thigh, I want you to do this rapid movement where you're gonna rotate your hands pretty rapidly. Okay, good. And now I want you to touch your toes and then follow my finger, okay? So touch your nose and now touch my finger. Nose, finger, nose, finger, same thing. Great. Now I want you to go back and I want you to show me the hand flipping one more time. Okay. I want you to touch your left heel to your right top of the shin and go down. Kind of let your other leg get a 90-degree angle and then go down. Okay, switch feet. Okay, great. If you don't mind hopping off for me, I'm gonna get you to walk that way to the room and then walk back. Okay, this time walk that way on your toes. And then come back on your heels. Okay, and then I'm gonna get you to hop twice in place. Great, okay, now I'm gonna get you to close your eyes and hold out your arms in front of you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Great, that was the Romberg's test, and I'm also testing for tremors, ties, or fasciculation, so anything in your arms like this. I've been watching your muscle movements throughout this. I didn't notice any tremors. I've been watching your facial features during this, and I didn't notice any problems with that either, okay? So we're gonna go ahead and test your muscle strength at this time. So go ahead and take a seat. And I want you to push up against my hands. Oh, yeah, I guess we could do one at a time. Push up with this leg. Okay, push up with this leg. Okay, and push down. And then push down. Okay, and then push up here. And push up here. And now I want you to push down like a gas pedal. Okay, kick me over. And then push down like a gas pedal. And then push up. Okay, and push up. Great. And then I want you to put your arms like this and pull up against me and then push down. Okay, great. And squeeze my fingers. All right, at a mild pace, or at a mild squeeze here, moderate. Okay, good. And then we already did the shrug. Let's do it one more time. Shrug up. All right, great. And then hold your arm out like this. Push down. And push down. Great. I'm going to take a look at my notes, make sure I didn't miss anything, and we'll finish the exam.
Sounds good.
Okay, so go ahead and put your fingers like this. I'm going to try to break it apart, okay? And then hold your hands out like this, hold your hands like this, and try to extend your fingers out. Great. Okay, it looks like everything. So we're gonna go ahead and prescribe you an x-ray just to make sure that there's nothing fractured in that elbow, but it does sound like something mild, or we'll ask you to just keep resting it, and you can put heat on it and then take your Motrin as needed, okay?
Okay.